Okay, thank you. Okay, time is start now.
All right. Hello, good evenings. My name is Teresa. I'm one of the pediatric child doctor here. I believe I'm talking to James' mom.
Yeah, good evening, doctor. Yeah, I am James' mom, Mrs. Maria.
Nice to meet you, Mrs. Maria. I'm here today to ask some questions regarding James' condition. Is that time suitable for you?
Please carry on, doctor.
All right, thank you. I have got a notes from the GP regarding James' conditions. Can you tell me what's your main concern regarding James?
Mm, Yeah, doctor. My son James, uh, he had just 2 days ago. He started puffy face. That means swelling of the eyelid and scanty urine. Last 24 hours, he passes only one single time pee. And
Oh.
another thing is uh, James has a recurrent attack of same illness like uh, last 2 years. He he's supposed to admit. Yeah, he was admitted 5 times and 5 relapse.
I'm sorry to hear that. It must be quite a lot for James and also to you as well. Can you elaborate more about puffiness of the face? You mentioned it started 2 days ago. How did it started?
Yeah, it started from swelling of the eyelid and then a whole face. No other swelling. That means no other bony part is swollen. Uh, and urine just initially he passed 3 to 4 times day, but last 24 hours he passed only single time.
Hmm. And is the swelling is only one part of the face, or it's both parts, all part of the
Yeah,
face?
it is both part of.
And do you notice is the swelling has been gradually progressive, or it's like coming in and off throughout the day, or it's like all the time of the day the swelling has been there?
It is all of the time, and it is just progressive.
Okay. And is anything that make the swelling worse?
No, I didn't find anything, doctor.
And have you done anything to relieve that swelling?
Um, yeah, after medication, yeah, so swelling reduce after 6 to 7 days, but no other factor.
Which medication, sorry?
Yeah, doctor, James took one small tablet. Name is prednisolone, maybe.
Okay. Yeah. So when was the last dose that James was on this steroid prednisolone?
Yeah, doctor, it was one month ago. Uh, just James took alternate day prednisolone, every other day prednisolone.
Hmm. So James was on the prednisolone 1 month ago. It was alternate day, and then it was stopped 1 month ago, and then his swelling has been restarted again as soon as
Yeah,
this medication has been stopped. Is that what I correctly understand you so far?
yeah, doctor.
Okay, all right. And you mentioned about the pee has been reduced. Do you notice any typical smells in the pee or any change in color of the pee?
Yeah, doctor, it is a high color, that is dark color, but it is not reddish or not reddish.
Hmm. And does the James has any pain doing the pee while going for pee?
Uh, no, doctor. He didn't complain about pain during pee.
All right. And is there any other symptoms apart from these two that you are worried about?
No, doctor. No.
Okay. Okay. Is there any tummy pain, any temperature, high fever?
Mm, oh, yeah, temperature. It was just 4 or 5 days ago. James had just flu-like symptoms, and at that time he had high temperature, but not right now.
Okay. Was James need any medication at the time?
Yeah, doctor. He took uh, only paracetamol and for antihistamine for flu.
Mm. Okay, all right. Do you notice in terms of general activities, does James look a bit sleepy, lethargy, drowsy these days?
No, doctor. Yeah, James is active.
Any change in terms of weight you concerned about?
Yeah, doctor. His weight is increased two kg for last 2 days.
Okay, I understand that. And was James complained about any chest pain,
No, doctor. No, just
any shortness of breath?
no,
Is there any chronic cough that James has?
no, doctor.
Any history of, rash like chickenpox or measles recently?
No, doctor.
All right. Do you notice any change in terms of tummy size, like tummy distension?
Abdomen, yeah, abdomen is distended, right? I can say that his abdomen tummy is slightly large right now.
Okay. And any change in terms of skin color, like yellow color of the iron skin, or
No,
any sickness, any feeling, nauseous feeling?
no, doctor.
Do you notice any rush in the body these days?
No,
Any pain that he complained about pains in the joint?
no joint pain, doctor.
Okay. Any headaches, any weakness of the body, do you notice?
No, doctor.
All right. What about appetite? Does his appetite is good or reduced?
Mm. Yeah, appetite is same as before, not reduce or not increase, doctor.
Okay. All right. That's good news. So you tell me that James has been diagnosed with this nephrotic syndrome 2 years ago. When was the last admission was 1 month ago? Am I correctly interpret you?
Yeah, doctor, 1 month ago.
Hello.
Yeah, doctor, 1 month ago. It was
You're
actually
audible, Dr. Hina. Please continue.
yeah, it is actually 1.5 month, doctor.
Okay. So within the 6 months, how many times does he need admissions because of this swelling and because of this nephrotic syndrome?
Last 6 month, he was admitted 2 times, doctor, two or three, uh,
Been two
uh,
times.
three times, doctor.
And then most of the time within 1 month after stopping the steroid, you have noticed this swelling. Am I correctly?
Yeah, doctor.
Yes.
When I stop medication, then again swelling appear. That is symptoms again reappear. Am I audible?
Stopping the steroid.
Hello.
Hello.
Uh,
Apart from steroid, is
yeah,
there
yeah.
any other medications that's James on?
No, doctor. Right now, no other medication.
Thank you. Any drug allergies that he has?
Mm, he has penicillin allergy, doctor.
Oh, thank you for letting me know that. And in terms of growth and development, do you have any concerns regarding his growth and development?
Yeah, doctor. His length is that is height is little short. I mean, he is short than his peers or say same age group.
Oh, I can see that. It must be quite concerning for you. Have you done anything for that?
Yeah, doctor. Sorry, what you tell? Sorry, doctor.
Have you consulted with the GP
Uh,
regarding this, or
yeah,
is this a question? Yeah.
yeah, doctor. I consulted with GP, but
Mhm.
just he advised me to keep follow up.
Mm-hmm. Yeah, I will look after that, and I'll discuss with my senior regarding this as well. Sometime, when child is on steroid for long duration, they might affect their height. So we will think about whether James might need other medications, just to help recover his symptoms, and so that we don't need steroid for long terms, if that's all right for you.
Uh,
And what about in terms of vaccinations? Is James up to date with all the vaccine?
yeah, doctor. James is up to vaccinated up to date, and GP was advised me to give extra vaccine, and I also gave him extra vaccine.
That's perfect. I just want to ask about uh your social status, because I understand it must be quite difficult for you taking care of Jane's condition with frequent admissions. How are you coping with that? Do you have any support?
Doctor, yeah, it's a really big burden for me as I am a single mom and I am working mom. So it is difficult to adjust with his medication and his treatment.
Mhm. I can see that. We'll look after that as well. We will think about whether we might need social support, or whether we might need to contact with social service regarding that as well, if you wish.
Thank
How
you,
does that
doctor.
sound to you?
Thank you,
Okay.
doctor.
Um, Perfect. I just want to ask a few more questions regarding James' academic works. Do you have any concerns regarding James' school's work?
No, doctor, he is fine at his school.
That's perfect. So, at home, to whom James is living, to with you or and any other persons?
Yeah, doctor. He's as I am a working mom, so I cannot give him time. So he's play with my another neighbor daughter.
Okay, all right, okay. And is there any family history of similar kidney problem or any autoimmune disease? Are you
Uh,
aware of?
yeah, no, doctor.
Okay, all right. Is there anything that I might miss that you want me to know for?
Mm, no, doctor. It's okay. So your time is finished. Sorry, due to net interruption, I forgot to warn you. So it is 13 minutes.
Yeah. So,
So,
all right. Thank you. So, I
so
took the history from Maria, who is the mom of 7 years old child called James. James was diagnosed with nephrotic syndromes 2 years ago, which has been his nephrotic syndrome has been relapsed frequently. He again presented today because of puffiness of face with reduced urine output for a few days, like 1 or 2 days ago. James was on a steroid 1 month ago, and then on alternate day dose, and then he stopped the steroid within 1 month. His symptom has been restarted again. There wasn't any history suggesting of anaphylactic syndrome, or no history suggestions of cardiac failures or liver failure. There isn't any family history of kidney problems, SLE or autoimmune disease. James currently has complications of steroid like standard growth. Apart from that, and there hasn't been any features of complication regarding nephrotic syndrome or steroid like hypovolemia infection so far. So based on my history, this is a case. 7 years old child with an aligned nephrotic syndrome with frequent relapse, probably steroid dependent case. I'll probably think about of whether the child might need referral to tertiary nephrotic kidney center for further investigation management.
okay. So why you tell yeah, steroid dependent?
So if oh okay sorry if you stop the steroid within 2 weeks symptoms started, we can call the steroid dependent. So sorry, so the Thai symptoms started 1 month after stopping, so I cannot say that steroid dependent. Yeah,
Yeah, it's a simple frequent relapse.
yeah, frequent relapse. Yeah.
Mhm. Okay, very good. I think it's almost perfect. And well, your puppy history was good. Urine is contain protein. Oh, you didn't ask me about proteinuria or uh,
That's right. Yeah.
protein that
Yeah.
is heat coagulation test, or how can I ask this question? Lipstick test is mom.
Yeah, we can say that, does any doctor suggest you to check the pee for any proteins in the urines? Do you
Mhm.
know how to check? Have you ever checked before you came to the hospital or the GP? Or was the GP mentioned that there is any protein in the urine this time? You can say like that. But do not say that urine dipstick because it is quite jargon.
Yeah, urine lipstick. Yeah. So just ask any. Uh, is he uh, was he checked or not about protein? Protein in the urine.
Pardon, what did you say?
Just mom was checked or not about protein in the urine.
Yeah, yeah, you can say that,
Hello, my network was
I
bad. Hello.
aware about the proteins in the urines before does any doctor suggest you to check them, whether she know how to check the urine for the this before she came to see you?
Hmm. Okay, but you maybe you missed about jaundice and breathlessness. This systemic.
No,
Uh,
I did ask about shortness of breath, and I did
but
ask about
Okay.
the yellow coloration of the skin. Yeah,
oh yeah, you
maybe
did.
because of neck error you did not hear.
Okay.
Yeah.
So maybe I I missed. Okay, so my network is poor today, fluctuating. I don't know.
That's all right. I've been in the country where network is such an issue, but you will pass. With that difficulties. If you
Mm-hmm.
pass this, then you will pass, inshallah. Don't worry.
Mm-hmm. And okay, abdominal pain, weakness. You ask fever. You ask headache and vision. Yeah, you ask headache. But rash joint. You ask chicken pox. You ask admission history. You ask and
I did not
cytokine.
ask headache. No, I
Huh?
did not ask headache. I
Headache.
forgot to ask about
No,
headache.
no, 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 no.
Yeah,
You
no.
you ask headache, but you forgot to ask about vision. You asked
Oh,
headache.
yeah.
Yeah,
Oh,
yeah.
yeah, I didn't ask about vision. Yeah, CNS, I forgot CNS. Yeah.
So I think it's a good history.
Yeah, but actually, in the past medical history, if we have time, we could elaborate more about under the care of nephrologists or pediatricians,
Mm-hmm.
specifically because sometime if the child is already under the care of nephrologists in the management plan, you
Mm-hmm.
might change your management plan. You don't need to refer for the tertiary. You just need to refer to his nephrologist.
Hmm.
Yeah.
Yeah. Okay. Okay.
So,
So I think I need to go. So tomorrow again we will discuss. Eh,
tomorrow I might not be free. Yeah, I may not be free tomorrow. I will join the next day.
Okay. 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 No issue. Yeah. Tomorrow. Again I need maybe. Oh, tomorrow I have a duty, night duty. Okay. So it is difficult for me tomorrow also. Hmm.
Yeah. But whenever you start the meeting, whenever I am free, I will join and listen. Yeah.
Okay, okay. So our rough time is like 9 this today's time to up to 11.
Mm-hmm.
That means
Dr. Hina,
Yes.
are you Are you have you joined any courses as such, or like you've been preparing on your own because you're really good?
Yeah.
No, no, thank you so much. I haven't joined, but I only, did DCH UK exam. And for the DCH, I have to done all those history and communication. That's why. But for the
Uh,
examinations and development, I might not be that much good.
But you
okay,
joined
but
free session, maybe some free session. Uh, Maybe I saw in that free session meeting. Is
Yeah,
it?
that's right. Whenever it's free, I join if I'm
Yeah,
free.
yeah.
Yeah. Don't worry, this MRCPCH clinical exam is such a fun. You all will love it.
Hmm.
So just take the exam, the practice, and don't worry about grammar error or language. Don't worry, just speak, and then you will find it. You will find very smoothly.
Okay.
Mhm.
And also, there is a good book called Dr. Kidil's History Taking book. It's
Mm-hmm.
also
Yeah.
nice. Have one. Use that one. Also, Rebecca book that is also very good, handwritten, also very good. Mrcpch is very good for clinical. So just finish all those books before the exam, and it's very easy to pass this exam. All you have to do is read the guideline whenever you are free, so that you can during the discussion time you can discuss very smoothly and fluently with the examiner if you know the guideline well.
Okay. Yeah. Yesterday we read nephrotic syndrome from guideline. That's why today I think it is no need. No need to discuss. Inshallah. Yeah. Next day we will again give another topics like UTI or
Yeah.
HAS, hemolytic uremic syndrome.
Yeah, it would be great. It would be great if other participant can also practice. So if we do
Yeah.
the two
Or
session and
next
with
day they can participate nephrotic syndrome. Yeah, Dr. Rebecca can you can next day you can present nephrotic syndrome, and as well as Ramisha or Zakia or Mariam. Everyone should participate. Otherwise, uh,
Yes. Mm. Yeah.
hmm. Okay, so
yeah, yeah, I think that if you want to finish nephrotic syndrome, all the participants should do that,
yeah, right,
so that they will not left.
yeah, I agree with you.
That's a
Okay,
good
so
idea, actually.
yeah, so next day, yeah, you two will participate, either Dr. Rebecca, you and Mariam or Ramisha.
Yeah, that's
We
good.
will do all things.
Thank you so
Nephrotic
much.
tomorrow. Inshallah.
Okay, okay, thank you. I have to go.
Bye.
Thank you.
Okay, bye.